Okay, so let's talk about headaches, one of the most common conditions that patients experience and who are referred to neurologists. Patients come in saying, I've had a severe headache almost every week, every month. Do I have a tumor? And that's unfortunately the first thought that enters patients' minds when they have headache, especially if it leads to nausea, sensitivity to lights or sounds, visual disturbances. And here's the good news for everyone out there that tumors, brain tumors in particular, are the least likely cause of recurrent throbbing headaches. In fact, not the most likely cause of headaches. And why is that? And the reason for that is because the brain itself, the actual gray matter, white matter, and brain tissue does not have pain receptors. So, in fact, neurosurgeons in the operating room are often poking the brain with instruments, and patients do not feel anything with respect to pain. So, then why do some patients end up having headaches from a brain tumor or from an aneurysm rupture? Well, we can go into that in more detail, but if the brain tumor, in fact, is causing an increased pressure in the brain, where the outer lining of the brain structure is stretched, and that is the dura mater, or it's compressing sensitive areas of the brainstem, for example, that's triggering inflammation of the trigeminal nerve, whether by direct compression or more likely the stretching of the dura mater, well, that can cause pain. Or blood vessels. The blood vessels are enriched with receptors that can trigger pain. So an aneurysm rupture causes a massive, severe headache, as they say, the worst in your life. And it's very sudden and it can lead to loss of consciousness or a coma. And that's because the aneurysm is a weakness of the walls of an artery that leads to rupture when under a lot of pressure. And so the blood vessel, in fact, is stretched. The walls of the blood vessel is stretched, causes severe headache. So if you ever experience the sudden onset of worst headache of your life, of course, you should always consider going to the ER or urgent care for immediate evaluation, especially if you're experiencing changes in your mental status, you're becoming drowsy. So that's very important. So what is the most common cause of headaches? Well, there are two major categories. Of course, everyone's heard of migraines, and we'll get into that in more detail, and tension headaches. So migraines are, in fact, one of the more common causes of severe headaches, and there is a very clear cascade of events that occurs in the brain with migraines. It's not just a headache. And unfortunately, there are so many misconceptions and misinformation regarding migraines. It's not just because you're anxious, and it's not just because you're having a bad day, but these are genetic causes, meaning there are genetic predispositions in many patients who have migraines. So first, let's describe the typical migraine. There are very many variants. There are all kinds of different variants to migraines and different types of migraines. But the classic migraine, or I should say, more typical migraine, consists of a gradual onset. So not a sudden onset, but a gradual onset of headaches, usually involving the periorbital, around the eyes, around the face, sometimes the back of the head, that starts gradually over a span of a few minutes, and not a thunderclap headache. So that's a different type of headache. That's, again, more likely to be an aneurysm rupture, for example. But a subacute gradual onset of a unilateral periorbital headache that then intensifies over the next several minutes or hours, often linked, but not necessarily so, with a feeling of nausea, sensitivity to lights and sounds. And some patients, in fact, many patients with migraines, experience numbness and tingling of the face. So also, the duration of the headache is often very long. So it's a matter of sometimes days when the headache, before the headache resolves. So if it's a short, transient headache lasting for a few minutes, it's not likely to be a migraine. So migraines are usually long-lasting, sometimes several days, sometimes several hours. As you know, as most people know, patients with migraines go into a dark room because they're so sensitive to lights and sounds. Now, there are different variants of migraine, but before I go into that, the cause of migraine is actual inflammation of the trigeminal nerve, the three branches of nerves that stem from the brainstem and get inflamed, and they cause the release of three chemicals. We know these three chemicals: CGRP, neurokinin, substance P. In fact, if someone somehow gets a syringe and injects any one of those chemicals into your scalp, you will have very much intense headaches and pain. So, in fact, they've developed medications and treatments that neutralize or block the action of some of these chemicals, including CGRP. That's how many of the newer drugs, including Nurtec and Aimovig, work. They block the action of CGRP. In fact, Botox injections block the release of CGRP in the nerve terminals. So there's much more details to the story regarding migraines, but know that it's a chemical cascade. In fact, it leads to electrical abnormalities of the brain, and often it involves the back areas of the brain, the cortex in the back of the brain, which is, guess what, involved in vision. So patients describe visual disturbances like blurry vision, lights and flashing lights, or these distortion of sparkling, moving lights that usually start in the center and move out, or in the periphery and move in, or traveling in different shapes, kaleidoscope type of shapes. Those are the typical migraine auras. By aura, I mean the beginning warning signs that you're about to have a migraine. But I personally have had visual symptoms that were very scary if I didn't know better, where it consists of this beautiful ring of lights, kind of like an electric light type of flashing that starts in one side of my visual field and travels to other side. And it can actually block your vision for a few minutes. So it is very important. It is actually debilitating. So there are treatments for migraines, which we can get into on another video, but know that the most common cause of headache is not a brain tumor. In fact, it's more likely to be migraine. I'll briefly talk about the other cause of headaches, which is tension headaches. And that's because these flat shaped muscles around the scalp and eye become very tight. And all of these muscles are interlocked to muscles of the neck. So often patients experience neck pain. And it feels like someone is putting a C-clamp and twisting the knobs like a pressure. So someone's pushing your head in, and that usually is due to muscle tension. What causes muscle tension? Guess what? Poor sleep, stress, and sometimes, although less likely, arthritic changes in the cervical spine or in the neck. So muscle tension due to poor sleep, chronic stress, and sometimes certain medications can in fact lead to these chronic tension headaches. What do they feel like? Again, dull pressure. It's not a severe headache. So patients often feel, maybe I have a tumor again because there's a pressure in my head. But again, the brain itself doesn't have pressure sensors. So how do you briefly treat tension headaches? Well, we have to find ways to help people sleep, reduce muscle tension. Sometimes it's from TMJ, biting and clenching all day long when you're focused or anxious or stressed. So one other thing I mentioned before we end this, there's such a thing as medication-induced headaches, what some patients refer, or some organizations refer to as analgesic rebound headaches. What is that? Well, naturally, most people are going to try to relieve their headache with a Tylenol or an Advil or these over-the-counters. Well, studies show that if you take these over-the-counter medications more than 3 or 4 times, and sometimes over a span of 1 or 2 weeks, or 6 or more times in a span of 3 months, it can lay down the groundwork for developing analgesic rebound headaches, where the headaches, in fact, just get worse and worse. So here you are taking Advil, Tylenol, etc., and it may give you a transient temporary relief for maybe a couple hours, only for the headaches to come back again and again and get worse and more frequent. So now people think, I really have a tumor because these headaches are not going away. So lastly, what do brain tumors usually cause? Well, the common symptoms are seizures, and there are different types of seizures. There may be paralysis or weakness or numbness that is persistent, because you can't have a tumor causing a symptom that just comes and goes. It will cause a persistent symptom. And headache is less likely, although it can happen with tumors, it is less likely to be the cause. Hope that was helpful and reassuring for many millions of people out there who suffer from recurrent headaches. Please leave any comments or questions in the comment section below. You can also join me on the Buy Me a Coffee site and ask more specific questions. And of course, always, always, always ask your doctor or neurologist for guidance. Do not rely on your own, guidance regarding these issues, because they could be very dangerous and sometimes life-threatening. I always ask for a physician or neurologist to evaluate you thoroughly and comprehensively. Thank you.